Welcome to Healthcare Simplified, a podcast from Deliver Health. Nothing's inherently simple about healthcare. That's why on Healthcare Simplified, we explore with today's top health leaders how to maximize ROI, staff satisfaction, and public health outcomes by building greater efficiencies into the healthcare connections that matter most between clinicians and technology, providers and patients, and people and their health. I'm your host, Mitch Holdick. Let's put simplicity to work together. Welcome to Healthcare Simplified. We are live from Shishmid in National Harbor, Maryland. I'm speaking with thought leaders today at the conference and really super excited for today's guest. We've got Cathy Connolley, President and COO with Doctivity. So before we get started, Cathy, for our listeners that don't know you or are learning about you, I would love to hear a little more background about who you are, where you're from, and what you do at Doctivity.
Sure. So I'm happy to be here. I have 23 years in healthcare, business, marketing strategy, and operations. I started my career inside Geisinger Health System in Pennsylvania. I'm originally from Pennsylvania. My whole focus of my 23 years has been around the business of healthcare and advancing strategies to grow new revenue, to help organizations be able to reinvest. I started a consulting company for 5 years doing the same type of work that I had done inside Geisinger. And then most recently, we've taken our strategies and automated them and started Doctivity. And we are a performance improvement and a physician relationship management software platform.
Excellent. I'm going to lean into that business of healthcare. You don't hear that a lot. I really like that angle. So tell me a little more about what you mean by the business of healthcare and how you guys approach that.
Sure. So we believe that in order to be able to continue to deliver quality patient care, you have to have the business side working and operating at the optimum level. So understanding what data is necessary and the strategies needed to continue to build the business and target the right referrals, which then drive in new patients, but all around business of healthcare and the cost of care. Because we believe in order to, like I said, continuing to be able to deliver quality patient care and reinvesting, you have to be able to have a healthy bottom line, to reinvest in new technology and staffing. And we're all dealing with skyrocketing costs of salaries, et cetera.
Yeah, that's great. And if you were to identify a couple areas where you've seen some progress, as you talk about your background kind of in the hospital and health system side, and now with Doctivity, you've got a great background. I would love to hear from you. 1 or 2 areas where you've seen some progress, and then kind of the flip to that is where are we going? Where is there opportunities for that to improve in the future?
Sure. So just walking around the Shishmid exhibit hall, I would say the CRM space is pretty crowded.
Yeah.
So dealing with patients and consumers, and we talk about the great data race. We know that everybody's trying to figure out claims and understand how organizations can use it. But where I see a lack of focus and where we're really trying to fill this niche is that the business side and understanding exactly what's needed from an EHR perspective, a claims perspective, understanding the referral markets to really be able to drive new patients, drive the business, and then improve that new revenue. Again, all around trying then to reinvest and improve quality patient care.
Yeah, I love what you said about the, simplifying. That's, the focus of our podcast and this show is bringing in thought leaders like yourself and other groups that are really committed to this from different areas. And I want to touch on something you mentioned with EHRs, because we know that's such a challenge right now, especially with mergers and acquisitions. And how do you get things to integrate? How have you guys kind of tackled that? Or what are some ways that you've simplified that challenge?
So because our team, we've all worked inside healthcare for years, we know that any organization is going to have a different EHR system. And so with all of the acquisitions that are happening, what we've done is we've made it really easy to partner with us. So it doesn't matter if you're using Cerner or Epic or whatever the EHR that's being used, we can ingest it into our tool. And I feel as though that is a challenge for healthcare organizations. as they look to find a partner to be able to extract the right data. But through all these acquisitions, the time that is spent trying to figure out how to transfer or to have a Cerner work with Epic or go through that whole transition, it's so costly.
Yeah.
I think that software platforms need to become more flexible to be able to ingest the data that's going to make it easier for their clients to work with.
Sure. And I imagine too, I'd love to get your thoughts on not just the software, but how hospitals, health systems, and other organizations adopt that, knowing that there's just so much to learn. I guess, what are your thoughts overall on adoption strategies and how to improve that?
Yeah. So what we've seen in the market, and it's really why we pivoted to develop Doctivity's platform. There are so many, I'll say, resources out there, data companies who approach it and they've built their framework or their systems, and they expect the health system to be able to, they have to mold or be able to plug into the framework. So the software, it's not flexible. And what we've done is the opposite. We have constructed ours in a way that we can ingest any data. We can work with any organization. We offer our claims along with our platform. Oftentimes what you see is there's companies that have the tool and then they've engaged with a claims vendor on top. And then on top of that will be a CRM or a consumer data component.
Yeah.
Doctivity setup, we are 100% focused on the business. So we don't have any PHI, which kind of makes our clients happy because we don't have to plug into their mainframe or their main systems. We're cloud-based and we don't have to worry about having any issues with patient information.
Sure.
So we just focus on, the true business data that's needed to make smarter strategic business growth decisions.
Yeah, it's interesting too, but you've kind of laid out a groundwork for how to manage the data integration piece. But then the next step is, what do you do with all this data? How do you interpret that? So what are your thoughts on that? Where are some gaps right now you see in the industry?
So when we were doing the consulting work before we moved into Doctivity, one of the biggest areas of need, there was a huge deficit in organizations. Everybody has data, right? But knowing the right data to pull and then how to do the analysis and then turn it into a strategic plan. And oftentimes organizations have data analysts, which is great, but it's understanding how to pull the data and do the analysis quickly, because sometimes it takes 6 months and the opportunity has moved or changed, the market's changed. So for us, our tool, our platform does the analysis for our clients. So based on what's most important to them, our product is 100% configurable. So we work with clients up front to understand what their needs are. And we construct our scorecards or dashboards. So with a couple keystrokes, they can see exactly those KPIs and how things are moving. They can easily see where they need to adjust their strategies, from individual providers to service lines to entire organizational, I'll say, strategic growth plans.
Yeah. I want to go back to the question we talked about, some of the things you're seeing as we're here live from Shishmid, a lot of emphasis around CRM and some consumer products. What are other just early stages here of Shishmid, things that you're hearing or trends you're seeing that are interesting to you?
The data, I think I mentioned, I believe there's this huge data race happening. Yeah. And as you walk through the exhibit hall, you can see the ones who are focused on consumer, patient journey, patient satisfaction. But what's missing is the true focus on the business, I believe. I think I would be remiss if I didn't say, there's plenty of, I know I mentioned about data analysts, but it's truly understanding what to do with the data. And the cost of healthcare it's skyrocketing and it impacts us all. It impacts the insurance business, value-based care, and understanding internally and helping executive teams to see where those opportunities are to pivot, to decrease the costs, and again, to be able to reinvest into their staff, technology, to be able to deliver that quality patient care. There's plenty of marketing firms out there and, content writers, but, for us, it's all about true business side of healthcare.
Sure. So I'm going to take a step back, even level up a little bit. When we talk about digital health, I think we can all agree there's this undeniable momentum around digital health from an investment perspective, from different digital health solutions and point solutions. And it's just kind of created this chaos. What are your thoughts on how we can start to simplify that? Maybe a couple areas that you think we could start to kind of untangle that chaos.
I'm a big proponent of education. And, you see different in the college and university level programs popping up around healthcare, not so much the provider end, but coding and things like that.
Sure.
For me, I'm a big believer, numbers don't lie. So for me, data is so important.
Mm-hmm.
And the training of data analysts to understand the healthcare business and what are those important pieces of data? What is the most important data and the data mix needed to be able to quickly pivot and drive action. So I would say education, even in terms of setting up a recruitment strategy, looking at data from where a potential candidate went to medical school and then where your organization is located, all of that matters.
Yeah.
And a more strategic focus on it.
Sure. Well, this has been a really good conversation. And before we wrap up today, I want to make sure our listeners know the best way to connect with you. So if you're okay with that, how can they connect with you?
Sure. Doctivityhealth.com is our website.
Thank you so much for joining the podcast today. And I encourage our listeners to reach out to you and hope you enjoy the rest of your time here at SHSMD.
Thank you.
Thanks again for tuning in. If you like what you heard, please share, rate, and review on Apple, Spotify, or your favorite podcasting platform. For more content about simplifying healthcare, visit deliverhealth.com/resources, where you'll find our blog, videos, and much more. We'll see you next time on Healthcare Simplified.